Sometimes the best way to change a stigma is going with it instead of fighting it. My name is Alejandro Bejarano. I am the co-founder and executive director of Mental Health Ecuador, Salud Ecuador, and we have the mission to improve the mental health of all inhabitants of Ecuador and the rest of Hispanics through free and low-cost mental health services. Despite the negative stigma that exists towards taking care of your mental health in Ecuador and the rest of Latin America, we started with this idea of offering Ecuadorians and the rest of Hispanics an innovative way to take care of your mental health. Currently, we have helped more than 470,000 people with our free and low-cost services, and we have reached more than 25 institutions, both from the public and the private sector. We started in July 2020, just before the pandemic started. We launched our website in October 2020 with our free and anonymous live chat. This was the first ever service that, instead of fighting the stigma, it considered the stigma to offer Ecuadorians a first aid mental health service. Moreover, we are not just helping rural communities and other vulnerable groups and institutions that have never been helped with mental health before. We are also implementing approaches to taking care of mental health. For example, with rural communities, we are helping them implementing the first ever rural community tourism with mental health workshop. This won't only provide them more workshops during those visits, but can also help them with their economics.
¿Cómo es eso? Cada rato me voy a ver a mi papá, a mi mamá. ¿Por qué estás saliendo cada rato? Yo no te la permití.
Our innovative approach has been accepted widely by many institutions in Ecuador. We have been invited by the National Assembly for law convocations in 2021, and we have edited and provided reforms for the new law that was approved last week, the first ever mental health law in Ecuador. Our approach has also been valued by the city of Quito, giving us a recognition for sustainable and innovative ideas in 2022. The impact we have created is still not over. We are still on this path to achieve and to sustain the United Nations Sustainable Development Goals. We are focused specifically in number 3, which is health and well-being. I want to thank SDG Awards for the opportunity, and I want to thank everybody that has been part of this movement, validating mental health, validating the importance of taking care, and also providing access to this integral health